Did you know that over 3.6 billion diagnostic medical imaging scans are performed worldwide every year? That means that healthcare professionals like you need to understand and use medical imaging vocabulary accurately to communicate effectively with colleagues and patients. Hi, I'm Jer, and this is Learning English Pro, the channel where healthcare professionals like you excel in English and advance in their careers. In today's lesson, we're learning 50 essential terms and phrases for radiology and medical imaging. These are the words and expressions you need when discussing scans, explaining procedures, and understanding imaging results, whether you're working with X-rays, MRIs, CT scans, or ultrasounds. This is the fourth episode in my healthcare vocabulary series. Previously, we covered mental health, physiotherapy, and phlebotomy. But don't worry if you missed these episodes, they are included right after this lesson on radiology and medical imaging, so just stay tuned to get all the vocabulary you need. And for my student members, I've created a PDF guide with all the terms from this lesson, plus additional exercises to help you revise and master the vocabulary. It's a great resource for OET and professional medical English learning. To join the student membership and boost your healthcare English skills, click the link in the video description. Now, let's get started with 50 terms for radiology and medical imaging. For each term that we look at today, you'll learn the pronunciation, the form, the definition, and I'll give you an example phrase so you'll be able to understand the context of the word. Medical imaging is essential for diagnosing and monitoring a wide range of conditions. Healthcare professionals must be familiar with different types of scans and their specific uses. X-ray. Repeat after me. X-ray. An X-ray is a radiographic image produced using ionizing radiation, commonly used to detect fractures and infections. Let's take a look at our example sentence. We'll take an X-ray of your chest to check for pneumonia. Let's move on to our next term. CT scan. CT scan. Otherwise known as computed tomography. This is a detailed imaging method that uses X-rays to create cross-sectional images of the body. The doctor ordered a CT scan to get a clearer picture of your abdomen. MRI. MRI. Otherwise known as magnetic resonance imaging. This is a scan using magnetic fields and radio waves to create detailed images of soft tissues. You'll need to lie still during the MRI so we can get accurate images. Ultrasound. Ultrasound. An ultrasound is an imaging technique that uses high-frequency sound waves to visualize internal structures. We're going to do an ultrasound to check your baby's development. Mammogram. Mammogram. A mammogram is a specialized X-ray used to detect abnormalities in breast tissue. Your mammogram results will be reviewed by a specialist. Fluoroscopy. Fluoroscopy. A fluoroscopy is a continuous X-ray technique that allows real-time imaging of movement in the body. The fluoroscopy will help us guide the catheter into position. Let's move on to DEXA scan. DEXA scan. Otherwise known as dual energy X-ray absorptiometry. This scan is used to measure bone density and assess osteoporosis risk. Let's check out our example. We're scheduling a DEXA scan to check for bone loss. Contrast imaging. Contrast imaging. Contrast imaging is a technique using a contrast agent to enhance the visibility of certain structures in scans. You'll need to drink a contrast liquid before your CT scan. PET scan. PET scan, otherwise known as a positron emission tomography. This is a nuclear imaging technique used to observe metabolic activity in tissues. The PET scan will help us detect any abnormal cell activity. Angiography. Angiography. Angiography is a specialized imaging technique used to visualize blood vessels. Angiography will help us assess any blockages in your arteries. Radiology professionals use a variety of specialized equipment to capture clear and accurate images for diagnosis. Let's take a look at some of these in our next batch of terms. Radiograph. Radiograph. A radiograph is a medical image produced by X-rays. The radiograph shows a small fracture in your wrist. Scanner. Scanner. This is a general term for any machine that can capture medical images. Please step onto the scanner bed and we'll begin the process. Transducer. Transducer. This is the handheld device used in ultrasound imaging to send and receive sound waves. I'll apply some gel before using the transducer on your abdomen. Lead apron. Lead apron. A lead apron is a protective garment worn to shield against radiation exposure. We'll place a lead apron over you to protect your organs from radiation. Contrast dye. Contrast dye. This is a substance used to enhance the visibility of certain structures in scans. You may feel a warm sensation when the contrast dye is injected. Radiation shield. Radiation shield. A radiation shield is a protective barrier used to reduce radiation exposure. The radiation shield will protect you during the procedure. Imaging plate. Imaging plate. An imaging plate is a component of digital radiography that captures X-ray images. We need to replace the imaging plate before taking another scan. Collimator. Collimator. This is a device used in imaging machines to focus X-ray beams. The collimator helps minimize unnecessary radiation exposure. Barium swallow. Barium swallow. This is a diagnostic test using barium contrast to examine the esophagus. You'll need to drink this solution for the barium swallow test. Gamma camera. Gamma camera. A gamma camera is a device used in nuclear medicine to capture gamma radiation images. The gamma camera will track the radioactive tracer in your body. Our next set of terms are useful for radiology professionals when they must guide patients through procedures with clarity and to ensure a patient's comfort during imaging tests. Positioning. Positioning. Positioning is the process of placing a patient correctly for an imaging scan. I'll adjust your positioning so we get a clear image. Exposure time. Exposure time. This is the duration a patient is exposed to X-ray radiation. The exposure time will be brief to minimize radiation. Scan duration. Scan duration. Scan duration is the time required to complete a scan. The MRI scan duration will be about 30 minutes. Next up, we have a phrase. Hold your breath. Hold your breath. And this is a common instruction to patients during scans. Please hold your breath for a few seconds while we take the image. Lie still. Lie still. This phrase is an instruction given to prevent motion artifacts in imaging. Try to lie still so we can get a clear picture. Turn onto your side. Turn onto your side. This phrase is a command given during certain imaging procedures. Please turn onto your side for this next image. Contrast injection. Contrast injection. The contrast injection is the process of injecting a contrast agent into the patient. You might feel a slight flush when we administer the contrast injection. Monitor for reactions. Monitor for reactions. This phrase relates to checking for allergic responses to contrast dye. We'll monitor for reactions after the contrast is injected. Remove metal objects. Remove metal objects. Here we are giving patients a common pre-scan instruction to remove things like jewellery and belts. Please remove any metal objects before the MRI. Follow my instructions. Follow my instructions. This phrase is a general instruction given to patients during scans. Please follow my instructions carefully for the best results. Let's move on to our next topic. These terms are useful after imaging is completed, when medical professionals must accurately describe their findings to ensure proper diagnosis and treatment. Abnormality. Abnormality. An abnormality can be any unusual or unexpected change in structure or function seen on an imaging scan. The scan shows a small abnormality in the lower spine, which we need to investigate further. Lesion. Lesion. A lesion is a region of damaged or diseased tissue. The MRI revealed a lesion in the liver that requires further analysis. Fracture. Fracture. A fracture is a break or crack in a bone, often identified on an X-ray or CT scan. The X-ray confirmed a stress fracture in the patient's tibia. Nodule. Nodule. A nodule is a small mass or lump of tissue, often found in the lungs, thyroid, or other organs. The CT scan detected a pulmonary nodule in the right lung. Edema. Edema. An edema is a swelling caused by excess fluid in body tissues. The MRI indicates significant edema around the knee joint. Effusion. Effusion. This is the abnormal accumulation of fluid in a body cavity, often seen in the lungs or joints. The ultrasound shows a mild pleural effusion in the left lung. Calcification. Calcification. Calcification is the buildup of calcium in tissues, making them appear denser on scans. The mammogram shows calcification in the breast tissue, which needs further evaluation. Mass. Mass. In this context, a mass is a large abnormal growth or lump seen on an imaging scan. The MRI shows a mass in the abdomen, which may require a biopsy. Atrophy. Atrophy. Atrophy is a decrease in the size of an organ or tissue due to disease or lack of use. The MRI suggests muscle atrophy in the lower leg following prolonged immobility. Metastasis. Metastasis. This is the spread of cancer cells from the primary tumor to other parts of the body. The PET scan confirms metastasis to the liver and lymph nodes. In our final section, we'll be looking at adjectives and how we can use them to provide precise descriptive language, which can help radiologists and healthcare professionals communicate imaging results effectively. Our first adjective is benign. Benign. Benign means that something is not cancerous and generally not harmful. The scan shows a benign cyst that does not require treatment. Malignant. Malignant. A growth which is malignant is one which is cancerous and potentially aggressive. The biopsy confirms that the mass is malignant and requires further intervention. Enlarged. Enlarged. The adjective enlarged describes when something is bigger than normal in size, often indicating swelling or abnormal growth. The ultrasound detected an enlarged liver, which could suggest infection or disease. Opaque. Opaque. We use opaque to describe when something is not allowing radiation or light to pass through, often appearing white on X-rays. The chest X-ray shows an opaque area that could indicate pneumonia. Dense. Dense. This word describes having a high level of tissue or material compactness, making it appear whiter on scans. The mammogram reveals dense breast tissue, which may require further imaging. Irregular. Irregular. If something is irregular, it is uneven or asymmetrical in shape, often requiring further investigation. The MRI shows an irregular mass in the pancreas that needs further testing. Hyperintense. Hyperintense. If something is hyperintense, it is appearing unusually bright on an MRI scan, often indicating fluid or high protein content. The hyperintense region in the brain scan may suggest inflammation. Hypointense. Hypointense. Hypointense indicates something appearing darker than surrounding tissue on an MRI scan. The hypointense area in the kidney may indicate reduced blood flow. Diffuse. Diffuse. We can use this word to describe when something is spread out over a large area rather than being localized. The CT scan shows diffuse swelling in the abdominal cavity. Our final term for this lesson is well-defined. Well-defined. We can use this adjective term to describe when something is having a clear, distinct edge, which can indicate a non-aggressive or benign condition. The lesion appears well-defined, suggesting it is not malignant. Well done, you've just learned 50 essential terms for radiology and medical imaging, a crucial area of English for healthcare professionals. Remember, if you're a student member, you can download the full PDF guide with all the terms from today's lesson, plus additional exercises to help reinforce your learning. If you haven't joined yet and want to boost your healthcare English skills, just click the link in the video description to become a student member today. And stay tuned, don't go anywhere, because up next is another important lesson, 50 essential terms for mental health. Don't miss it, and see you in the next lesson. Healthcare is a field where communication is just as important as medical knowledge. Whether you're a doctor, nurse, therapist, or any healthcare professional, mastering English is key to building trust with patients, collaborating with colleagues, and excelling in your career. That's why I've created this healthcare vocabulary series, a deep dive into essential English terms used across different medical fields. Each lesson in this series is packed with tons of vocabulary phrases and professional language tips to help you sound natural and confident in any healthcare setting. Today's lesson is just one of many, and there's so much more to come. Hi, I'm Jer, and this is Learning English Pro, the channel for healthcare professionals to excel in English and advance in your careers. Today, we're exploring 50 essential healthcare terms with the focus on mental health. Mental health is a critical part of patient care in all healthcare contexts. Whether you're a psychologist, a therapist, nurse, doctor, or any professional working with patients, this lesson is packed with valuable vocabulary you'll use every day. For each of the 50 terms, you'll perfect your pronunciation, understand the meaning, and get real-life professional context with example sentences. This is a complete Cambridge-style English lesson designed to help you master meaning, form, and pronunciation for professional use. To take your learning even further, I've created a useful downloadable guide with all the vocabulary plus exercises for this lesson. It's available exclusively for my student members on the membership tab. Want access? You can join today and unlock this PDF plus so much more. The link to join is in the video description. Alright, enough business, let's get straight into our 50 essential healthcare terms for mental health. Our first set of words focus on diagnostic terms. Our first word is neurodivergent. Repeat after me. Neurodivergent. This adjective describes individuals whose neurological development and functioning differ from societal standards of normal. Let's take a look at our example sentence. The patient identifies as neurodivergent, exhibiting traits consistent with autism spectrum disorder. Let's move on to bipolar disorder. Bipolar disorder. This is a mental health condition characterized by extreme mood swings, including manic and depressive episodes. The patient has been diagnosed with bipolar disorder and is currently experiencing a manic phase. Next up is schizophrenia. Schizophrenia. This word describes a severe mental disorder involving distorted thinking, perceptions, and a diminished ability to function. Early intervention is crucial in managing schizophrenia to improve long-term outcomes. Next up, we have obsessive compulsive disorder, better known as OCD. This disorder is characterized by unwanted recurring thoughts or obsessions and repetitive behaviors or compulsions. Let's check out our example sentence. Cognitive behavioral therapy is effective in treating patients with obsessive compulsive disorder. Another common disorder is post-traumatic stress disorder, better known as PTSD. This is a condition triggered by experiencing or witnessing a traumatic event, leading to severe anxiety and flashbacks. The veteran was diagnosed with PTSD following his return from active duty. Our next batch of words deals with symptomatic terms. Anhedonia. Repeat after me. Anhedonia. This noun describes an inability to experience pleasure from activities usually found enjoyable. The patient's anhedonia is a significant barrier to engaging in therapeutic activities. Affective flattening. Affective flattening. This term describes a reduction in the expression of emotions, often seen in facial expressions and voice tone. Affective flattening was observed during the mental status examination. Let's move on to our next term, hypervigilance. Hypervigilance. This is an enhanced state of sensory sensitivity and exaggerated awareness of surroundings. Hypervigilance in the patient suggests underlying anxiety issues. Our next word is rumination. Rumination. Rumination is the act of continuously thinking about the same thoughts, often negative, which can contribute to depression. Let's check out our example sentence. Addressing rumination is essential in the cognitive therapy of depression. Psychomotor agitation. Psychomotor agitation. This term describes unintentional and purposeless motions stemming from mental tension and anxiety. The patient's psychomotor agitation has decreased with the new medication regime. Our next topic is treatment-related terms. Psychopharmacology. Psychopharmacology. This is the study of the use of medications in treating mental disorders. Let's check out our example sentence. Advancements in psychopharmacology have improved outcomes for patients with mood disorders. Let's move on to cognitive behavioral therapy, better known as CBT. This is a type of psychotherapy that helps patients identify and change negative thought patterns and behaviors. CBT has been effective in reducing symptoms of anxiety and depression in adolescents. Next up, we have electroconvulsive therapy, also known as ECT. This is a medical treatment involving electrically induced seizures to treat severe mental disorders. ECT is considered when patients with severe depression do not respond to medication. Next up, we have mindfulness-based stress reduction, also known as MBSR. This is a therapeutic approach combining mindfulness meditation and yoga to reduce stress. MBSR programs have been integrated into treatment plans for patients with chronic anxiety. Let's move on to dialectical behavior therapy, also known as DBT. This is a form of therapy designed to help individuals manage intense emotions and reduce self-destructive behaviors. DBT is particularly effective for patients diagnosed with borderline personality disorder. Our next section deals with descriptive terms used in mental health care. Euthymic. Euthymic. This adjective pertains to a normal, stable mood state, neither depressed nor manic. Let's check out our example sentence. The patient has remained euthymic for several months with ongoing treatment. Let's move on to labile. Repeat after me. Labile. In mental health, labile describes emotions characterized by rapid and unpredictable changes. The patient's mood was labile, shifting from tears to laughter within minutes. Our next term is dysphoric. Dysphoric. Dysphoric is used to describe when a patient is experiencing a state of unease or generalized dissatisfaction. The patient reported a dysphoric mood throughout the past week. Psychosomatic. Psychosomatic. This term relates to physical symptoms caused or aggravated by mental factors. Stress can lead to psychosomatic symptoms such as headaches and stomach aches. Somatic. Somatic. And this adjective describes symptoms relating to the body, especially as distinct from the mind. The patient presented with somatic complaints, including fatigue and muscle pain. Our next batch of words relate to common behavioral terms used in mental health care. If you've been affected by any of the terms covered, please make sure to seek help from a professional. Self-harm. Self-harm. This is the act of deliberately inflicting pain or injury on oneself. The patient has a history of self-harm but denies any recent incidents. Suicidal ideation. Suicidal ideation. This is the presence of thoughts about or planning suicide without necessarily making an attempt. The patient reports experiencing passive suicidal ideation, but denies any intent or plan to act on it. Addiction. Addiction. Addiction is a compulsive dependency on a substance or behavior, often leading to harmful consequences. The patient's addiction to opioids has led to significant health complications. Compulsion. Compulsion. A compulsion is a repetitive, irresistible urge to perform a behavior, often linked to OCD. Hand washing has become a compulsion for the patient, interfering with daily activities. Delusion. Delusion. A delusion is a firmly held, false belief that is resistant to evidence or logic. The patient exhibits delusions of grandeur, believing they have supernatural abilities. Hallucination. Hallucination. This is a sensory perception that occurs in the absence of an external stimulus, often auditory or visual. Auditory hallucinations are a common symptom in schizophrenia. Derealization. Derealization. This is a feeling of detachment from one's surroundings, as if the external world is unreal. During periods of high anxiety, the patient experiences derealization, experiencing the world as dreamlike. Disassociation. Disassociation. This is a mental process where a person disconnects from thoughts, feelings, memories, or identity. The patient disassociates during stressful events, reporting memory gaps and emotional numbness. Hyperfixation. Hyperfixation. An intense and prolonged focus on a specific interest or activity, often linked to ADHD or autism. The patient describes hyperfixation on video games, leading to neglect of personal hygiene. Codependency. Codependency. Codependency is a behavioral condition where one person enables another's addiction or unhealthy behavior. The therapist is working with the patient to establish boundaries in their codependent relationship. Emotional dysregulation. Emotional dysregulation. This is difficulty managing emotional responses appropriately. Patients with borderline personality disorder often struggle with emotional dysregulation. In our next section, we're going to take a look at common mental health verbs. Diagnose. Diagnose. To diagnose is to identify a medical condition based on symptoms and tests. The psychiatrist diagnosed the patient with generalized anxiety disorder. Medicate. Medicate. To medicate is to administer medication as treatment. The patient was medicated with an SSRI to manage depressive symptoms. Prescribe. Prescribe. This verb means to authorize the use of specific medication or treatment. The doctor prescribed an antidepressant to help regulate mood. Stabilize. Stabilize. This word means to bring a patient's condition to a steady, controlled state. The goal is to stabilize the patient's mood swings through therapy and medication. Let's move on to regress. Regress. To regress is to revert to a previous, less advanced state of mental or emotional well-being. After discontinuing therapy, the patient showed signs of emotional regression. Suppress. Suppress. This word means to reduce or inhibit a mental or emotional response. The medication helps suppress intrusive thoughts in patients with OCD. Our next term is to cognitively reframe. Cognitively reframe. And this means to shift perspective on a thought or belief to reduce stress. Cognitive reframing is a key technique in treating negative thought patterns. Disclose. Disclose. To disclose means to reveal or share personal information, often in a therapeutic setting. The patient was hesitant to disclose past trauma, but gradually opened up. Reinforce. Reinforce. To reinforce means to strengthen a behavior or thought pattern, either positively or negatively. Therapists use positive reinforcement to encourage healthy coping strategies. Validate. Validate. To validate is to acknowledge and affirm someone's emotions or experiences. It's important to validate the patient's feelings before offering solutions. In our final section, we're going to take a look at medications and therapy-related terms used in mental health care. First up, we have SSRI, or selective serotonin reuptake inhibitor. This is a class of antidepressants that increase serotonin levels in the brain. Let's take a look at our example sentence. SSRIs, like fluoxetine, are commonly prescribed for depression and anxiety disorders. Anxiolytic. Anxiolytic. An anxiolytic is a medication that reduces anxiety. The patient was prescribed an anxiolytic to manage panic attacks. Mood stabilizer. Mood stabilizer. A mood stabilizer is a type of medication that helps balance mood fluctuations, often used in bipolar disorder. Lithium is a widely used mood stabilizer for bipolar disorder. Neuroleptic. Neuroleptic. Neuroleptic is another term for antipsychotic medication used to treat conditions like schizophrenia. Neuroleptics can help manage symptoms of psychosis but may have side effects. Exposure therapy. Exposure therapy. Exposure therapy is a psychological treatment that involves gradual exposure to anxiety triggers to reduce fear. Exposure therapy has been highly effective for patients with phobias. Trauma-informed care. Trauma-informed care. This is an approach that recognizes and responds to the impact of trauma in patient care. Trauma-informed care ensures that the patient feels safe and respected in therapy. Somatic therapy. Somatic therapy. Somatic therapy is a therapeutic approach that focuses on the connection between mind and body in processing trauma. Somatic therapy techniques, like grounding exercises, help patients reconnect with their bodies. Psychosocial intervention. Psychosocial intervention. This is a non-medical approach to improving mental health through social and behavioral strategies. Group therapy is a common form of psychosocial intervention. Mindfulness meditation. Mindfulness meditation. This is a practice that involves focusing on the present moment to improve mental well-being. Mindfulness meditation is integrated into therapy to help manage stress and anxiety. Holistic psychiatry. Holistic psychiatry. This is an approach that combines conventional psychiatry with alternative and complementary methods. Holistic psychiatry considers lifestyle, diet, and emotional well-being alongside medication. Well done, you've just completed this lesson on 50 essential healthcare terms for mental health. This is just the beginning. There's so much more to learn in the healthcare vocabulary series. And don't go anywhere because coming up next is our next batch of 50 healthcare terms. And this time the topic is physiotherapy. Did you know that 80% of adults will experience back pain at some point in their lives, and that rehabilitation professionals, including physiotherapists, are in higher demand than ever? If you're preparing for the OET exam, working in rehabilitation, or simply looking to improve your medical English, Mastering the right vocabulary is crucial. Hi, I'm Jer, and this is Learning English Pro, the channel where healthcare professionals like you excel in English and advance in their careers. Today, we're diving into 50 essential healthcare vocabulary terms, with a focus on physiotherapy, movement, and rehabilitation. This lesson comes from a student member request. And if you're a student member of Learning English Pro, your requests get priority. Plus, you'll get a handy downloadable guide with each lesson. The one for this lesson includes all the vocabulary from this lesson, fun exercises to test your knowledge, and links to additional medical English guides from Learning English Pro. If you want access to these exclusive materials, the link to join is in the video description. Alright, enough business. Let's get started with 50 key healthcare vocabulary terms for physiotherapy. We'll cover pronunciation, form, meaning, and context, just like a real Cambridge English lesson. Let's begin. First up, we're going to look at nouns relating to physiotherapy. And our first term is joint stability. Repeat after me. Joint stability. This term refers to the ability of a joint to maintain proper alignment during movement. Let's take a look at our example sentence. Joint stability is essential for athletes to prevent injuries during sports. Let's move on to our next term, which is muscle atrophy. Muscle atrophy. Muscle atrophy is the wasting away or decrease in muscle mass due to inactivity. Extended bed rest can lead to muscle atrophy, making rehabilitation more difficult. Tendinitis. Tendinitis. This is the inflammation of a tendon, often caused by repetitive motion. The runner developed tendinitis from overtraining without proper rest. Let's move on to myofascial release. Repeat after me. Myofascial release. This is a therapy technique used to relieve muscle tightness and pain. Myofascial release techniques can help reduce tension in tight muscles. Our next term is gait analysis. Gait analysis. This is the study of a person's walking pattern to detect abnormalities. Let's check out our sentence example. Gait analysis showed that the patient was favoring one leg after surgery. Our sixth noun is ergonomics. Ergonomics. Ergonomics is the science of designing workspaces to reduce strain and injury. Good ergonomics in the workplace can prevent chronic back pain. Prosthesis. Repeat after me. Prosthesis. A prosthesis is an artificial body part, such as a limb or joint replacement. After losing his leg in an accident, he was fitted with a prosthesis. Let's move on to orthotics. Orthotics. Orthotics are custom-designed inserts or devices to support and align the feet. She wears orthotics in her shoes to support her arches and prevent pain. Our next term is balance board. Balance board. A balance board is a tool used in therapy to improve stability and coordination. The therapist recommended using a balance board to improve coordination. Spinal alignment. Spinal alignment. This refers to the correct positioning of the spine to prevent pain and injury. Spinal alignment is crucial for reducing chronic back and neck pain. Compression bandage. Compression bandage. A compression bandage is a tight wrap used to reduce swelling and support injured areas. The doctor applied a compression bandage to control the swelling. Kinesiology tape. Kinesiology tape. This is a flexible tape used to support muscles and reduce pain. Kinesiology tape helps support the athlete's knee during recovery. Neuroplasticity. Neuroplasticity. This refers to the brain's ability to reorganize itself by forming new connections. Neuroplasticity allows stroke patients to regain lost motor functions. Our next term is TENS, which stands for transcutaneous electrical nerve stimulation. And this refers to a device that uses electrical impulses for pain relief. The patient uses a TENS machine to manage chronic pain in his lower back. Biomechanics. Biomechanics. Biomechanics is the study of human movement and mechanics. Let's look at our example sentence. Biomechanics helps us understand how different movements affect the body. Rehabilitation Center. Rehabilitation Center. This is a medical facility focused on recovery from injury or surgery. He spent 3 months in a rehabilitation center after his knee surgery. Soft tissue therapy. Soft tissue therapy. This is a treatment that involves manipulation of muscles and tendons. Soft tissue therapy reduced the tension in his shoulders and neck. Motor control. Motor control. Motor control is the ability to regulate and direct movement. Motor control exercises helped the patient regain movement in his arm. Let's move on to bursitis. Bursitis. This is an inflammation of the fluid-filled sacs that cushion joints. Bursitis in her shoulder made lifting heavy objects painful. Our 20th noun is the term scar tissue. Scar tissue. Scar tissue is thickened fibrous tissue that forms after an injury or surgery. Scar tissue formed after the surgery, affecting her range of motion. Well done, that's 20 nouns relating to physiotherapy and movement. And next up, we're going to take a look at some verbs relating to physiotherapy and movement, so get ready. All the definitions I give will be in the context of physiotherapy and movement. The first verb we will look at is mobilize. Mobilize. Mobilize means to move a joint or muscle to restore function. And let's take a look at our example sentence. The therapist mobilized the patient's stiff ankle to improve flexibility. Strengthen. Strengthen. Strengthen means to build up muscle power and endurance. Resistance exercises help strengthen weak muscles after an injury. Let's move on to retrain. Retrain. And this word means to teach a body part to function again after injury. The patient had to retrain his walking pattern after a stroke. Contract. Contract. As a verb, contract means to tighten a muscle actively. He was instructed to contract his abs during the exercise. Stabilize. Stabilize. In physiotherapy, to stabilize means to make steady or maintain proper alignment. Bracing techniques help stabilize her injured knee. Activate. Activate. This means to engage a muscle group during movement. The exercise activates the glutes and improves lower body strength. realign, realign. This word means to restore correct positioning of bones or joints. The chiropractor realigned his spine to relieve pressure on the nerves. Next up, we have elongate, elongate. This word means to stretch or lengthen a muscle. Stretching helps elongate muscles and improve flexibility. Rehabilitate, rehabilitate. This word means to restore strength and function after an injury. The clinic specializes in rehabilitating sports-related injuries. Engage, engage. To engage means to actively use a muscle group. Engaging the core is crucial for proper posture during exercise. Next up, we have loosen, loosen. And this means to reduce stiffness or tightness in muscles or joints. Massage therapy helped loosen tight muscles in his back. Reprogram, reprogram. This means to train the nervous system to adapt to new movement patterns. Stroke patients need to reprogram their nervous system for movement recovery. Reinforce, reinforce. This means to strengthen a movement or posture through repetition. The therapist reinforced proper walking techniques through repetition. Optimize, optimize. To optimize means to improve efficiency and effectiveness in movement. Optimizing movement patterns can enhance athletic performance. Prevent, prevent. To prevent means to take steps to avoid injury or deterioration. Wearing proper footwear can prevent ankle injuries. That's all the verbs we're going to cover. Next, let's move on to some adjectives relating to physiotherapy and movement. Our first adjective is weight-bearing. Weight-bearing. And this term describes something supporting body weight while standing or moving. Weight-bearing exercises strengthen bones and muscles. Our next term is the opposite of weight-bearing. Non-weight-bearing. Non-weight-bearing. This adjective can be used to describe an injured limb which has to avoid any pressure. After surgery, he was on a non-weight-bearing protocol for 6 weeks. Pain-free. Pain-free. We use this term to describe when one is without any discomfort or pain. She was relieved when her knee became pain-free after treatment. Progressive. Progressive. We use this term to describe when something like an injury or condition increases in difficulty or intensity over time. Let's check out our example sentence. The therapist used a progressive approach to increase exercise intensity. Isolated. Isolated. We use the term isolated when something like an exercise is targeting a specific muscle or movement. Isolated muscle exercises target specific weak areas. Controlled. Controlled. This term describes when something is done with precision and focus. Controlled movements help prevent injuries during rehabilitation. unstable, unstable. Unstable describes a situation or maybe a person's movement which is lacking balance or stability. An unstable surface forces the body to engage stabilizing muscles. Compensatory, compensatory. Compensatory is used to describe situations where adjusting movements are made to make up for a weakness. Compensatory movements can indicate muscle imbalances. Inflamed, inflamed. If something is inflamed, it is swollen and painful due to an irritation. Her wrist was inflamed after overuse at work. Restricted, restricted. In physiotherapy, we can use restricted to describe a patient who is limited in movement or range of motion. The cast made her ankle movement restricted. Let's move on to optimal. Optimal. Optimal describes the best possible condition for function or recovery. The patient reached an optimal recovery state after months of therapy. Symmetrical, symmetrical. Symmetrical is used to describe when conditions are even and balanced on both sides of the body. A symmetrical gait is important for proper walking mechanics. Overactive, overactive. We use overactive to describe a person or perhaps muscles which are working excessively, often leading to strain. Overactive muscles can cause tightness and discomfort. And next we have the opposite of overactive, underactive, underactive. And similarly, this describes a person or maybe muscles which are not working enough, and it can lead to muscle weakness. An underactive glute can lead to poor hip stability. Our final adjective and final word for this lesson is resilient. Resilient. To be resilient is to be able to recover quickly and adapt to movement. A resilient mindset helps patients recover faster from injuries. Well done, you've just learned 50 essential healthcare vocabulary terms focused on physiotherapy, movement and rehabilitation, a huge step in improving your medical English. Student members, don't forget to download your guide packed with all the terms, exercises and links to additional resources. If you're not a member yet but want to access, click the link in the video description. What if there was a series that explored medical vocabulary in detail, giving you not just words but pronunciation, form, definition, and real-life context? Well, I've got you covered. Hi, I'm Jer and welcome to Learning English Pro, the channel for healthcare professionals like you to excel in English and advance in your career. In today's lesson, we'll explore 50 essential terms for healthcare with the focus on phlebotomy. Whether you're a nurse, doctor, or any healthcare professional, this lesson will help you communicate clearly and confidently in a medical setting. We'll go through each term just like a real Cambridge English lesson, covering pronunciation, word form, definition, and example sentences and context. To help my student members practice and reinforce what they learn, I've created a PDF guide for this lesson, which includes all the terms, definitions, and content, plus additional exercises to improve your understanding. As a student member of Learning English Pro, you get a new guide with every new lesson. If you'd like to join, the link is in the video description. Alright, let's get started with 50 essential phlebotomy terms for healthcare professionals. To start, let's cover some essential syringe-related terms. These are tools used in injections, blood draws, and sample collection. Understanding their names and functions will help you communicate clearly in a medical setting. Our first term is needle. Needle. Needle is a synonym which is commonly used interchangeably with syringe. Though technically, the needle is just one part. It is the sharp metal tip that penetrates the skin. Let's take a look at our example sentence. A 23 gauge needle is commonly used for blood collection. Let's move on to hypodermic syringe. Repeat after me. Hypodermic syringe. This is a syringe with a fine needle used for subcutaneous or intramuscular injections. Hypodermic syringes are commonly used for vaccines. Vacuum tube. Vacuum tube. A vacuum tube is used for blood collection, often instead of a traditional syringe. For venipuncture, we usually use a vacuum tube system. Auto-injector. Auto-injector. This is a device that administers a dose automatically without the need for manual injection. An epinephrine auto-injector is used for severe allergic reactions. Barrel. Barrel. The barrel is the cylindrical body of a syringe that holds the liquid. Check the barrel to ensure the correct dosage. Bevel. Bevel. This is the angled tip of the needle that facilitates smoother insertion. Insert the bevel facing up for a less painful injection. Hub. Hub. The hub is the base of the needle that attaches to the syringe. Twist the hub securely to attach the needle. Our next term is luer lock. Luer lock. And this is a type of syringe tip that allows the needle to be securely twisted on. Luer lock syringes help prevent accidental detachment of the needle. Slip tip. Slip tip. This is a simple push-on connection for needles. Slip tip syringes allow quick and easy needle attachment. Safety cap. Safety cap. A safety cap is a protective cover for the needle to prevent accidental injuries. Always replace the safety cap before disposal. Now let's move on to key equipment and terms used in phlebotomy. From blood collection tubes to centrifuges, these are the tools and concepts every healthcare professional should know. Tourniquet. Tourniquet. A tourniquet is a band used to constrict blood flow to make veins more prominent. Apply the tourniquet about 3 inches above the puncture site. Venipuncture. Venipuncture. This is the process of inserting a needle into a vein to draw blood. Proper venipuncture technique reduces the risk of complications. Butterfly needle. Butterfly needle. This is a small needle with flexible tubing for delicate veins. Use a butterfly needle for patients with fragile veins. Lancet. Lancet. A lancet is a small, sharp tool used to puncture the skin for capillary blood collection. A lancet is commonly used for glucose testing. Vacutainer. Vacutainer. A vacutainer is a blood collection system that includes a tube, needle, and holder. Let's have a look at our example. Choose the correct vacutainer tube based on the required test. Centrifuge. Centrifuge. This is a machine used to separate blood components. Place the blood samples in the centrifuge for proper separation. Our next term is serum. Serum. Serum is the liquid portion of blood that remains after clotting. The lab requires a serum sample for the test. Plasma. Plasma. Plasma is the fluid part of blood that contains clotting factors. Unlike serum, plasma contains fibrinogen. Hematoma. Hematoma. A hematoma is a localized collection of blood outside blood vessels. A hematoma may form if pressure is not applied correctly. Capillary. Capillary. This is a tiny blood vessel where blood is collected from the finger or heel. Capillary blood is often used for rapid glucose testing. Anticoagulant. Anticoagulant. An anticoagulant is a substance that prevents blood clotting. Heparin is an anticoagulant used in certain blood tests. Hemolysis. Hemolysis. This is the breakdown of red blood cells, which can often affect test results. Avoid shaking the tube forcibly to prevent hemolysis. Needle stick injury. Needle stick injury. This is an accidental puncture by a used needle. Report any needle stick injury immediately to the supervisor. Gauge. Gauge. Gauge is the thickness of a needle. Smaller numbers indicate a larger needle. A 21 gauge needle is commonly used for routine blood draws. Evacuated tube. Evacuated tube. A vacuum-sealed container used for blood collection. Select the appropriate evacuated tube based on the test ordered. Phlebotomy isn't just about equipment, it's about actions. In this section, we'll focus on important verbs used during blood collection and handling, ensuring you understand the correct terminology for each step of the procedure. Palpate. Palpate. To palpate is to feel with the hands, in this case, to locate veins. Always palpate the vein before inserting the needle. Anchor. Anchor. This verb means to hold the vein steady before puncture. Use your non-dominant hand to anchor the vein. Insert. Insert. This means to introduce the needle into the vein. Gently insert the needle at a 15-degree angle. Withdraw. Withdraw. Withdraw means to remove the needle from the vein. Slowly withdraw the needle once blood collection is complete. Invert. Invert. This means to gently mix blood with the additive in the tube. Invert the tube 5 to 10 times to ensure proper mixing. Label. Label. To label means to mark the blood sample with patient details. Always label the sample immediately after collection. Dispose. Dispose. To dispose means to discard needles and biohazardous waste safely. Dispose of used needles in the sharps container. Recollect. Recollect. This means to draw blood again if the first sample is inadequate. A hemolyzed sample may require you to recollect the blood. Aspirate. Aspirate. In this case, aspirate means to pull back on the syringe to check for blood return. Never aspirate when using a vacuum collection system. Apply. Apply. And this means to place pressure or a bandage on the puncture site. Apply firm pressure to prevent bruising. To describe veins, needles, and blood samples accurately, you need the right adjectives. This section will help you use precise language when assessing patients and handling samples. Our first adjective is fragile. Fragile. And this describes something which is easily damaged, often used to describe veins. Let's take a look at our example. Elderly patients often have fragile veins. Superficial. Superficial. This describes something located near the surface, like a vein, making it easier to access. Use a superficial vein for easier blood collection. Deep. Deep. This describes a vein which is situated far below the skin's surface. Some patients have deep veins that require ultrasound guidance. Next up, we have clotted. Clotted. Clotted describes blood that has solidified. A clotted sample cannot be used for a coagulation test. Sterile. Sterile. If something is sterile, it is free from bacteria or contamination. Always use a sterile needle for venipuncture. Finally, let's look at common phrases used in phlebotomy. These collocations are essential for giving instructions, explaining procedures, and ensuring smooth communication with patients and colleagues. Locate a vein. Locate a vein. This means to identify a suitable vein for venipuncture. Use a warm compress to help locate a vein in difficult cases. Confirm patient identity. Confirm patient identity. And of course, this means to verify the patient's details before drawing blood. Always confirm patient identity before collecting a sample. Apply a tourniquet. Apply a tourniquet. And this means to restrict blood flow and make veins more visible. Apply a tourniquet for no longer than 1 minute. Insert the needle. Insert the needle. And this means to puncture the vein with the needle. Slowly insert the needle at the correct angle. Draw blood. Draw blood. This common phrase means to collect a blood sample. Use the correct technique to draw blood efficiently. Remove the tourniquet. Remove the tourniquet. This means to release the restriction after blood flow is established. Remove the tourniquet before withdrawing the needle. Prevent hemolysis. Prevent hemolysis. And this means to prevent breaking red blood cells. Handle the sample carefully to prevent hemolysis. Dispose of sharps. Dispose of sharps. This phrase means to safely discard needles and other sharp instruments. Always dispose of sharps in designated containers. Fill the tube. Fill the tube. This means to allow blood to flow into the collection tube. Hold the tube at an angle to fill the tube correctly. Check for bleeding. Check for bleeding. And this final phrase means to ensure the puncture site is still not bleeding. After removing the needle, check for bleeding and apply pressure. Well done! You've just learned 50 essential terms for phlebotomy, covering tools, procedures, and common phrases used in medical settings. Student members, don't forget to download the PDF guide for this lesson. It includes all the vocabulary from this lesson plus exercises to reinforce your learning. You can access it by joining as a student member. The link is in the video description. Feeling nervous about the OET speaking test? Don't worry, I've got you covered. In this lesson, we're diving into the exact tips, strategies, and confidence boosters you need to ace your role play scenarios as a dentist. From building rapport with patients to handling unexpected questions like a pro, you'll leave this video ready to impress the examiners and succeed. Your OET success story begins right here. Hi, I'm Jer and welcome to Learning English Pro, the channel for healthcare professionals like you to excel in professional English and pass the occupational English test like a pro. Today we are looking at the OET speaking test for dentists, covering the test structure, practical tips for role-play scenarios, and strategies to communicate clearly and confidently. Get ready to master English phrases and actionable practice steps to help you ace your exam. And stick around after this lesson because I'm including 2 additional lessons for dentistry in English. Explore dentist vocabulary and phrases, and then explore patient phrases for a dental appointment. This is your OET Dentist Masterclass for speaking. Student members of my channel should head over to the membership tab to download the exclusive PDF guide for this lesson. It includes all the tips and strategies along with additional role-play cards for dentist scenarios in the OET test. If you're not a member of my student membership, why not? It's full of great perks to help you boost your OET English skills. The link to join right now is in the video description. Let's get started. Let's cover some practical tips first. Arrive at least 30 minutes before your test to avoid stress and get familiar with the environment. Dress professionally. While it's not a formal interview, dressing smartly helps you feel confident and professional. You'll need to understand the format. There are 2 role plays. Each begins with 3 minutes to read and prepare, followed by a 5-minute role play. But don't worry, we'll break it down further in the lesson. Arriving a little bit earlier gives you some preparation time to calm yourself. review your notes, and think about the flow of the upcoming conversations. The speaking examination will begin with a brief informal chat for about 2 or 3 minutes with the examiner. This will allow you to get relaxed and comfortable. In this chat, it is likely you'll be asked simple questions about your work or professional background. This part is not scored and does not contribute to your final grade. It's important to understand the structure of the role play tasks. There are 2 scenarios you must participate in. Each role play conversation will run for about 5 minutes, and you will have 3 minutes to prepare for each scenario. For the preparation, you'll be given a role play card, and as I mentioned, you will have 3 minutes to review and prepare. Let's take a look at one. So, what do you need to focus on when you get this card? We need to make sure we are showing empathy with the patient and building rapport or a good relationship. Explaining medical terms in simple language is essential. We also need to keep the patient at the center of the conversation, asking open-ended questions and checking that they understand. And you need to do all of this in the required time limit. So this covers our approach to the task. But what are we being tested on? And of course, being an English test, key linguistic skills will be observed and marked by your examiner, but also your clinical communication skills. Are you friendly to your patients? Approachable? Are you providing clear information, focusing on patient needs? And do you have a beginning, middle, and end and a clear structure to the consultation or conversation? Don't worry, it's a lot, but I will show you how to do all of this in a moment. In the scenario, the examiner will play the role of a patient, a caregiver, or sometimes another health professional. You will be playing the role of a dentist, or perhaps another healthcare professional if applicable. Let's go back to that role-playing card and break down how to prepare for the role play. By the way, if you want to take a closer look at this role-play card along with more examples, you can access it on the Student Members PDF guide for this lesson. First up, check the setting and your role. Ensure you have the correct type of scenario for your examination. Next, take a look at the patient's key issues and concerns. In this case, the patient has a severe toothache in the upper right molar for the past week. That is the key issue. The patient has some nervousness about treatment and cost. So while your clinical approach will see you addressing the pain and treatment for this patient, the additional twist is that you must also be considerate of their situation and feelings. The task list provides you with everything you need to approach the conversation. What is clear straight away is that you should begin with a focus on gathering information from the beginning. I'll show you phrases for this in a moment. Then it's all about communicating diagnosis and treatment with the patient, with the context of their concerns being fully addressed. In this case, the pain of the treatment, fear of root canal treatment, and the cost of treatment. Ensuring to check patient understanding and showing empathy and reassurance throughout the role play scenario. The end of the conversation should focus on aftercare, expectations, instructions, recovery time, and follow-up appointments as necessary. It sounds like a lot to consider, but remember, you are already a capable professional doing this every day with patients in your own language. And next, I'll show you lots of English phrases for you to practice and perfect your OET speaking. When it comes to beginning the role play, we immediately begin to build rapport with the patient. This will help make them comfortable, but also help you feel comfortable too. Where possible, use the patient's name. This is a great personal touch. Hi, I'm Dr. Smith. I understand you've been experiencing some pain. Can you tell me a bit more about it? Once the patient starts to detail their key issues, it's time for you to gather as much information as possible. Ask targeted questions about the patient's symptoms relating to duration, severity, and things that might trigger the issue. When did the pain start? On a scale of 1 to 10, how severe is the pain? Does the pain get worse when you eat or drink something hot or cold? When it comes to explaining the causes of the issue and providing a diagnosis, it is 100% essential to simplify medical terminology for the patient. Describe terms in everyday English. My key for this approach is clarity. Be clear and keep it simple. Empathy. Don't overwhelm the patient with dental jargon. Be professional. Stay calm and be confident. The pain could be due to a cavity, infection, or inflammation, and an x-ray will help us confirm the cause. If it's an infection, a root canal will clean the infected tissue inside the tooth and seal it to prevent further damage. Let's take a look at more ways we can avoid jargon to be clearer for your patient. Instead of, "you have pulpitis in your molar," say, "it looks like the soft tissue inside your tooth is inflamed, which is causing the pain." Instead of saying, "endodontic therapy involves cleaning the root canals," say, "a root canal is a procedure to clean the infected area inside your tooth and seal it to prevent further damage." You need to be able to anticipate what the patient may ask you about. Questions will obviously be about the issue, but will also involve their concerns. In this case, nervousness and the financial cost of the treatment. Stay confident. This helps keeping the patient reassured. Discuss costs and provide flexible payment options if relevant. And remember, always be kind and empathetic. This helps to make the patient feel seen, respected, and understood. Some great terms you can use to show kindness are, "I see. That must be very difficult." "I understand. Let's get you as comfortable as possible." "Don't worry. You are in good hands." We'll ensure you're completely numb during the procedure, so you won't feel any pain. "I understand that dental procedures can feel intimidating. I'll guide you through every step and ensure you're comfortable." We'll discuss payment options that work for you. So you're doing great and covering all the bases so far. Now it's time to wrap up the conversation by summarizing what you've discussed with the patient and going over aftercare procedures. We summarize to ensure patient understanding, and this helps us lead into talking about the next steps with aftercare. Aftercare covers recovery and dietary restrictions, as well as follow-up appointments. Remember, you are still keeping language simple to avoid overwhelming the patient. Let's take a look at how we can summarize everything for a patient. So, to summarize, the pain in your upper molar is likely caused by an infection in the tooth. We'll confirm this with an x-ray and then proceed with a root canal to clean and seal the tooth. This will stop the pain and protect the tooth from further damage. You'll be completely numb during the procedure, so you won't feel any pain. Afterward, you might experience some mild discomfort, which can be managed with painkillers. And for aftercare, we also have some great phrases by topic. For pain management, you may feel some mild soreness for 1 to 2 days, but over-the-counter painkillers like ibuprofen should help. Dietary restrictions. Avoid hard, crunchy, or sticky foods for at least 48 hours. Stick to soft foods like soup, mashed potatoes, or yogurt. Oral hygiene. Continue brushing your teeth, but be gentle around the treated area. Avoid flossing near the tooth for a couple of days. And for a follow-up appointment, we'll schedule a follow-up visit in a week to check your healing and finalize the treatment, such as placing a crown if needed. If the patient requires help, If you experience severe pain, swelling, or fever after the procedure, contact us immediately. All that's left to do is close the conversation. Here, the main task is to ensure the patient leaves the consultation feeling informed, reassured, and confident in their next steps. You're in great hands, and this treatment will help eliminate the pain and protect your tooth. If you have any questions or concerns after the procedure, don't hesitate to reach out. Let's book your follow-up appointment now, and we'll also provide written aftercare instructions for you to take home. By following my instructions, you'll have the perfect role-play scenario. But what if things don't go to plan? Nobody's perfect, and anyone can make a mistake or forget something in a pressurized environment like an examination. So let's run through some tips for when things don't go to plan. First of all, don't panic. You already have the answer. Think back to your notes and your preparation time. You did a great job in those 3 minutes. Think about what is useful to you in that moment. If you don't know what to say, try and keep the conversation moving by asking the patient a relevant question or summarizing what you've discussed so far. Just to confirm, you mentioned the pain worsens with hot drinks. Is that correct? If you think you've said something unclear, use these phrases to rephrase or clarify. Let me rephrase that for you. What I meant was, let me explain that in a different way. If you think you said the wrong thing or the patient seems confused or asks for clarification, acknowledge this calmly and provide further explanation.
I'm not sure I understand what a root canal is.
I apologize for any confusion. A root canal is a procedure where we clean the inside of the tooth to remove the infection and then seal it to prevent further issues. If you are going blank, buy yourself some time. Use these fillers to keep things moving along and give yourself time to recover. That's a great question. Let me think about the best way to explain this. Let's take a moment to go over this together. Stay calm and positive. Remember, you know the answer. Let's quickly recap what we've covered today. First, we discussed how to prepare for the OET speaking exam by understanding the role-play structure and using your preparation time effectively. Then we explored strategies for building rapport, explaining procedures clearly, and addressing patient concerns. Finally, we talked about handling unexpected challenges and keeping the conversation smooth and professional. Student members, don't forget to download your exclusive guide for this lesson, filled with additional exercises to boost your OET speaking. Want to join and get lots of amazing perks? Click the link in the description now. And coming up, we are focusing on English vocabulary and phrases relating to dental English. After this, we are examining phrases commonly used by patients in a dentist appointment. To navigate ahead, check out the timestamps in the video description. Let's get started. Our first segment covers general vocabulary relating to the dentist. And what is a dentist? This is a healthcare professional specialized in diagnosing and treating diseases and conditions of the teeth and gums. Let's check out our first two phrases. I have an appointment with the dentist next Thursday for a checkup. Our second phrase is, the dentist recommended another appointment. You may also meet a dental nurse. A dental nurse assists the dentist in providing dental care to patients. They prepare the dental instruments and ensure patient comfort. The dental nurse prepared all the tools for my treatment. The dental clinic is a facility where dental professionals provide dental treatments and services to patients. I found a dental clinic near my house that has excellent reviews. Next up, we have tooth or teeth. What's the difference? Tooth is singular, referring to one unit, while teeth is plural, referring to multiple units. Let's try each in a sentence. I have a pain in my back tooth. I brushed my teeth thoroughly this morning. A checkup or a dental checkup is a routine examination by a dentist to assess the overall health of your teeth and gums. I would like to schedule a checkup with the dentist, please. You need a dental checkup every 6 months. Let's move on to common symptoms and problems one may encounter with teeth. A toothache refers to pain or discomfort in or around a tooth, often caused by issues such as cavities, gum disease, or an infection. Let's check out our 2 example sentences. I have a toothache. This toothache is killing me. Our next tooth problem is sensitive teeth. Sensitive teeth experience discomfort or pain from cold, hot, sweet, or very acidic foods and drinks. I can't eat ice cream because I have sensitive teeth. My dentist recommended a special toothpaste for my sensitive teeth. Sore gums are inflamed and often painful gum tissues, sometimes a sign of gum disease. Brushing too hard can lead to sore gums. I have sore gums, so I'm using a softer toothbrush. Next up, we have bad breath, also known as halitosis. This is an unpleasant smell emanating from the mouth, often a sign of poor dental hygiene or dental issues. Regular brushing and flossing can help prevent bad breath. Bad breath might be a sign of underlying dental problems. A cavity is a hole in a tooth that develops from tooth decay. Eating too much sugar can lead to cavities. The dentist filled a cavity in my molar. And our next term is decay. This refers to the destruction of tooth enamel by bacteria producing acids from food debris. Regular checkups can help detect tooth decay early. Tooth decay can be prevented with good oral hygiene. Another common dental problem is gingivitis. This is an early stage of gum disease characterized by red, swollen gums that may bleed easily. Gingivitis is reversible with professional cleaning and better oral care at home. Ignoring gingivitis can lead to more serious gum disease. Plaque is a sticky film of bacteria that forms on teeth, leading to cavities and gum disease if not removed. Brushing and flossing daily helps remove plaque. Our next phrase is, plaque can harden into tartar if not cleaned off regularly. An infection in dentistry refers to harmful bacteria overgrowth that can cause tooth decay, gum disease, or abscesses. Dental infections can spread if not treated promptly. A problem you might encounter if you have an accident is a broken tooth or broken teeth. These are teeth which have been chipped, cracked, or fractured. Our example phrase is, He broke a tooth playing hockey and needed emergency dental care. A problem for those who drink tea and coffee are teeth stains. These are discolorations that can affect the surface of the tooth. Teeth stains can be caused by coffee, tea, or smoking. In our next segment, you will learn the different treatments and procedures that are carried out in a dentist's office. A clean and polish is a dental procedure to remove plaque, tartar, and stains, leaving teeth clean and smooth. A clean and polish can make your teeth feel amazingly smooth and clean. Fillings are materials used to fill cavities and restore decayed teeth back to their normal shape and function. You may need a filling if you have a cavity. The filling was quick and my tooth feels normal again. Crowns or caps are dental restorations that completely cover or cap a damaged tooth, strengthening it and protecting it. The dentist said a crown would be the best way to repair my cracked tooth. Our next treatment is whitening or dental whitening. This is a cosmetic dental procedure that lightens teeth in color and helps remove stains and discoloration. Teeth whitening can significantly improve the brightness of your smile. Whitening treatments are popular for removing years of stains. Our next procedure is the dreaded root canal. A root canal is a treatment to repair and save a badly damaged or infected tooth instead of removing it. A root canal can relieve pain and save your natural tooth. Many people fear root canals, but the procedure is usually painless. Another feared procedure is a tooth extraction. A tooth extraction is the removal of a tooth from its socket in the bone, usually due to damage or decay. Wisdom teeth often require extraction to prevent overcrowding. Tooth extraction might be necessary if a tooth is too damaged to save. Dentures, also known as false teeth, are removable replacements for missing teeth and surrounding tissues. Let's use dentures in a phrase. Modern dentures are comfortable and look very natural. Veneers or dental veneers are thin, custom-made shells designed to cover the front surface of teeth to improve their appearance. Veneers can transform your smile by correcting chips, stains, or gaps. Dental implants are metal posts or frames surgically positioned into the jawbone beneath your gums to replace missing teeth. Dental implants provide a strong foundation for fixed or removable replacement teeth. And our last term for this lesson is bonding. Bonding is the application of a tooth-colored composite resin to repair a decayed, chipped, fractured, or discolored tooth. Our final phrase is, bonding is a quick procedure that can usually be done in one visit. Wow, you've done a great job learning dental vocabulary and phrases. Now it's time to move on to our final segment, where we focus on phrases commonly used by patients in a dental appointment. Student members can access the full list on the exclusive PDF guide. First up, let's take a look at some phrases you will need when making an appointment with the dentist. I'd like to schedule a dental checkup, please. Are you experiencing any pain or discomfort? Yes, I have a toothache. Can I book an appointment for a cleaning and examination? Do you have any availability this week for a dental visit? How long will the appointment take? Let's move on to some phrases you will use when you're arriving at the dentist. I have an appointment under the name John Smith. Do I need to fill out any paperwork? I'm here for my 2:30 appointment. I have dental insurance. Where do I provide the details? So next up, it's time to talk to the dentist. Let's cover discussing symptoms or concerns. I've been experiencing sensitivity to hot and cold. This tooth has been bothering me for a while. I think I might have a cavity. I've noticed bleeding when I brush my teeth. I'm worried about the colour of this tooth. Let's move on and cover phrases and questions you may use during the examination. Will I need an X-ray today? Please let me know if you're going to do something that might cause pain. Can you explain what you're doing? Is that normal or should I be concerned? Let's cover some of the things that we can say when we're discussing treatment options. What treatment options do I have? Do I need to have this tooth extracted? What are the benefits and risks of this procedure? How much will the treatment cost? Is this covered by my insurance? Your appointment is almost over, and you may have questions about what to do after the treatment. What kind of aftercare will I need? Should I expect any pain after this procedure? When can I eat or drink after the treatment? Do I need a follow-up appointment? In our final section, let's take a look at a few phrases we may use if we want to schedule another visit. Can we schedule my next checkup? How often should I come in for a cleaning? Please remind me a week before my next appointment. You've done an amazing job sticking through this lesson, and I know you're on the right path to smashing your OET exam. Remember to keep practicing, stay calm, and show your empathy and professionalism during the test. And come back to this video. Repetition is really important for learning English. If this video helped you, don't forget to like and subscribe, and let me know in the comments what topic you'd like me to cover next. If you want to learn more English phrases for patient care, click the link on screen now. That's all for today's lesson. Thanks for joining me. I'm Jer. This is Learning English Pro, and I'll see you in the next lesson.